Okay, so here we have the aorta, which is a large artery that emerges from the right ventricle and it carries blood to the systemic system. The apex zone here is the point of the heart that consists of muscles from the left ventricle. Then we have arteries that would come off of the aorta that carry blood away from the heart. The atrium, there's the two upper chambers of the heart that receive the blood. The auricle is the ear-like flap made up of the atria. The base is the point of attachment for blood vessels returning and exiting the heart. The bicuspid valve is here, and it is the atrioventricular valve between the left atrium and the left ventricle. It's also known as the mitral valve. The brachiocephalic trunk is the branch of the aorta that splits to form the right subclavian artery and the right carotid artery. The chordinae tendineae are these little fibrous cords that connect the bicuspid and tricuspid valves with the papillary muscles. The coronary artery is an artery that leads from the aorta that supplies blood to the heart muscles. The inferior vena cava is the largest vein that would come here that returns blood from the lower body regions to the right atrium. The superior vena cava is the largest vein that returns blood from the upper regions to the right atrium. Interventricular septum is the muscular wall between the left and right ventricles, which would be kind of this here. Papillary muscles would be up in here, and they're the ones that are the muscles that anchor the chordinae tendineae to the valves. Then we got the semilunar valve. It's the valve between the aorta and the left ventricle, and between the right trunk and the right ventricle. Superior vena cava. We did that. The trabecular cardinae are the ridges and folds of the wall of the ventricles. And the tricuspid valve would be here. And so the atrioventricular valve between the right atrium and the right ventricle. Veins are blood vessels that return blood to the heart. They're kind of all over. And then the ventricle is one of the lower chambers of the two. Well, there's two ventricles total. There's the right ventricle and the left ventricle, and it's where the blood is forced to go, and then it goes out either the aorta or the pulmonary arteries.